Okay, this is Mitchell Jacobson with the drug Furosimide. The father that I'm going to be teaching to is my brother Gabe. Here's my note card. It says Furosimide, side effects, this is patient education, and there's my dosage calculation for the patient, the baby. First thing I'm going to do is I'm going to check the MAR for the first time, check the 5 rights of medication, the patient, medication, the dosage, the route, and the time. And also check for any drug allergies. And I also check for the expiration date on my liquid Furosimide. Then I would also review the chart for the patient's type of learning style that I can provide at the very end when we're discharging them. Okay, and then I perform my second check with 5 rights of medication again, all the same. Check the expiration date, everything. Then I would come into the patient's room, knock, knock, knock. Perform hand hygiene, introduce myself. Hi, I'm Mitchell Jacobson. I'll be your nurse today. Can I get your child's name and date of birth?
Gabriel Luke Jacobson, May 19th, 2005.
Okay, perfect. And then I would check, again, it's the MAR, again, one more time. Check the 5 rights of medication, check the expiration date, check again for allergies. And then I would explain the drug. So your child is getting a loop diuretic called Furosimide, and some of the side effects that you might see are dehydration, rash, hyperglycemia, and electrolyte imbalance. And you especially might see dehydration and electrolyte imbalance since Furosimide acts by increasing the amount of water and electrolytes that your child would be excreting through urine, and this will help decrease your child's blood pressure. Have any questions about that?
No.
Okay, so with your Furosimide, you're going to administer it to your child orally at the same time every morning. Does that make sense?
Yep.
So what's a good time for you? Is that before school or before preschool?
Yeah, before school.
Okay, so that's a good plan. So with your child, since he weighs 22 pounds, I've made up a dosage calculation for you to tell you how much to give to your child every morning. Since your child is 22 pounds, we convert that into kilograms, which is 10 kilograms. And then since prescribed 2 milligrams a day, you take 2 times that 10 kilograms to get 20 milligrams. And since your Furosimide medication says to give, since the dosage is 10 milligrams per milliliter, you divide that 20 milligrams by 10 to get 2 milliliters. So every morning at the same time, administer 2 milliliters of Furosimide orally with your syringe and your Furosimide that you pick up at the pharmacy after this. Does your child have any problems with taking oral medication with swallowing or anything?
No.
Doesn't cough up medicine usually or anything? Pretty good with taking medication?
Yep.
Okay, perfect. So if you do everything right, you should be good. Some things you might want to watch for in your child if they are urinating less than normal, since this is a loop diuretic, it will increase the amount of times and the amount they pee. So that would be an opposite effect of what we want. So call your doctor if your child experiences any of these things. So I'm going to give you some information on the drug, just reminding you when to take it, how much, some side effects and everything. And there's also your doctor's number on there. Call if any of the things I explained happen. And do you have any questions?
No.
Okay. Have a nice day, Gabe.
You too.
And I would document into the EHR just everything that I did. Documented that I gave client education, that client understands. And yeah, that's pretty much it.